People around the world are getting jabs of COVID-19 vaccines, but you won't see children lining up for a shot. That's because the vaccines haven't been authorized for people under the age of 16. Children and young teens were not included in initial clinical trials. But now, several vaccine developers are testing the vaccines on younger people to monitor their immune responses.
Yeah, it is quite strange, but I'm feeling really lucky to have been given the opportunity to be able to have the vaccine.
In February, 16-year-old Miara got her first injection of the Oxford AstraZeneca vaccine. It was a proud moment for her mom.
She was looking for something throughout the whole of the pandemic to play a part in improving the future for everybody, so really proud that she's wanted to take part.
Younger people are substantially less vulnerable to serious infection, but they can still transmit the virus. With people under the age of 14 accounting for just over a quarter of the global population, vaccinating children is seen as an important component to reaching herd immunity. Leading infectious diseases expert Dr. Anthony Fauci predicts the vaccine will be authorized for teenagers by the fall, but younger kids will have to wait a little longer.
If you project realistically when we'll get enough data to be able to say that elementary school children will be able to be vaccinated, I would think that would be at the earliest the end of the year and very likely the first quarter of 2022.
But even if a vaccine is authorized for younger people, there's no guarantee parents will sign up to vaccinate them. A new report by the Harvard T.H. Chan School of Public Health surveyed mothers in 16 countries. Globally, 69% of them said they would be willing to give their children the COVID-19 vaccine. But in some countries, including Russia, Australia, and the United States, vaccine hesitancy remains high.
We do have that movement of anti-vaccine as a kind of general vaccine attitude. But on the other hand, this particular vaccine hesitancy against COVID-19 vaccine is so much broader than that, than the typical anti-vaxxer.
Wu is the lead author of the report. She says people living in countries like India with a high prevalence of infectious diseases are more likely to support vaccinating their children against COVID-19 because they have seen the benefits of vaccines on their communities firsthand.
The perception of COVID-19 in terms of the risk needs to be broadened to think about the consequence on the community and the country as a whole.
Without that shift in perception, Wu says we are less likely to return to normal anytime soon. Karina, CGTN.